can feel it, but that's not what's causing it. Right. Okay.
No. Like scar. Okay, so what scar tissue really is, by definition, is it's really tissue that increases in tone and texture, and it could be after an injury, and it's three-dimensional, just like a spider web. It goes front, back, up, down, left, right, diagonally, whatever. And what it does is it helps to manipulate the tissues so that the tissues can't glide and slide. So a presence of scar tissue, or if one tissue does not slide and glide past another, you will have sticking, so to speak. That's where Graston comes in. That's where active release comes in. That's where myofascial release can help for certain. The question would be, why did you initially get results? Maybe that helped the nerve glide and slide. Maybe it helped muscles glide and slide past each other. But then your body kind of adapted to it. Or maybe it wasn't enough. Or maybe it wasn't being done in the right area. I think you did good treatment. Again, they were kind of working everywhere from the front to the back. I'm going to show you the nerves here. I'll come hang out with you over here. So this distribution that you're talking about is the sciatic nerve, and more specifically, you're talking about the tibial division, which is the S1 nerve route, which is this. This is the nerve that goes down to the back of the calf. It innervates the calf, and if we get rid of this plantar fascia, this is the branch of that. So come on, here we go. See how it kind of goes all the way through? So this is why sometimes the calf cramping can occur. I personally think it's a neural issue, not as much of a other issue. That doesn't mean we don't work the nerve. It doesn't mean we don't work the muscles. I just think that giving a broad-based blade, which is what I do for a living, is not going to fix it. I do think that there's other areas, and this is one of the reasons why I think maybe the first ray or the first part like cramps up. It's because you're stretching on this nerve. Everything you told me, when you stretch this nerve out, when you do certain activities, you're starting to get increased symptoms. So if a nerve is really pissed off and irritated through this area, I would not stretch it more, because it's kind of doing this. It's like tugging on a shirt that's already irritated. I don't think that's going to help it. I personally don't think your nerve is entrapped here in this area. I just don't think it is. How am I confident on that? Because you probably wouldn't do as many of those calf raises without having that issue, because the muscle contracts around that. So if the muscle contracts around this nerve, or this nerve even deeper, it's going to tighten up around that nerve, and then it's going to say, okay, I'm going to increase in symptoms. You didn't really increase in symptoms in them. But I did find that in the hamstring, you were one, weaker, and two, so maybe this is the source. And by the way, you do also have numbness and tingling up into the butt area. So here's the sciatic nerve, and this hamstring is innervated all by this sciatic or tibial division of sciatic nerve. So this is all the same darn issue. However, you had more symptoms of me doing anything to you within the hamstring component of this nerve than anything else.
Okay.
I did not yet test the hip rotator, but I did test your glute extension, which is the butt off the chair.
Okay.
And you were beaming fine on that, surprisingly. I was actually shocked on that one.
Okay.
You're having some tightness up through the lower back. It could be a disc issue, a history of an old disc issue. I'm going to treat it as if it's a disc issue with a hamstring entrapment.
Okay.
What the heck does that mean? That means in the spine, when we have a disc issue, and I can show you on the other model that I have in the room, is that, let's get rid of this. A disc is really compression. That's why I kept asking you a couple times about this area. Whereas if you compress the disc, it kind of squashes it, which can push it backwards. I personally don't think you're having an active disc at all. Not even close. However, you might have some remnants of it. Okay. So that's like, I don't know. I'm just gonna like moving a furniture. It's like it's not there, but like you can see the imprint of the marks on the floor. You know what I mean? So it's like it's not there, but there was something there before. So I don't think you're having active disc issues. So I'm not gonna treat you as if you were having one. The extension exercise that we did on the floor helped to alleviate that stuff. You had no symptoms on that, surprisingly, but all the stuff that you told me, bending forward, touching your toes, stretching the hamstrings, increase your symptoms. So that's probably an old sign that you had some irritation back there. So we can work a little bit through the lower back and pelvis, and this is maybe one of the reasons why the sciatic nerve does jump out of this area. So I'd be interested to see if we worked some of this area to see if that would help you or not.
Okay.
I think what if I had to work anything and you said, hey, just work one thing right now, I gotta go, I would probably just work your hammies. Most disc patients, I do not work their hamstrings on their first time. I would work the hammies around that area. I normally don't do it, but your case is very, one, advanced because you're physically capable. 2, you've had this long standing, and 3, you're not having major symptoms. So I think you can really benefit from me just kind of getting in there from day one.
Okay. Yeah, it's like almost like I wish you could see it when it's like really fired up, and then maybe you'd get a I don't know.
But still, if it is in the calf, which I saw the flickering happen,
Yeah. I guess
you do have the same. It's still part of this area.
Mm-hmm. So it really wouldn't benefit much to see it.
I mean, if you want to send it a video of me showing, that's fine. But the fact that it's also cramping the bottom of the foot tells me that too, because the other part of the division. Now, interesting enough, I tested you and you didn't really feel like you didn't come up positive for that, for the stretching component of it, or the contraction component, but you did come up positive with the contraction component of it causing issues there, and you had weakness back there. So, again, this would be the box of like what I found.
Okay.
Pandora's box there.
Well, let's go with that.
I do think it's more neural based than it is scar tissue. Now, let's explain kind of what the goal would be then. The goal, as with Grasson, would be to make the tissue glide and slide further. But in this case, I would say that Grasson is great, but at the same time, I'm going to do a different technique called active release. Why am I going to do a different technique? One, you already had results and they stopped. That doesn't mean we wouldn't do it, but it just means we would do it that in addition to what we're going to do, which is ART, which is going to be more specific on like literally getting back behind that hamstring in that exact location and really pinning down the muscle so that the nerve could slide past it. It's almost like, imagine you're at a stoplight and you look away at me and you're like just driving, and then you look back to the normal, but you don't see the stoplight, and the truck goes forward and it makes you feel like you're going backwards.
Yeah.
You stayed still, but the truck went forward. So relative to that, you went backwards.
Okay.
So that's what we try to do is we pin down one muscle and we'll make the muscle slide, which will make the nerve glide. I think we can do some advanced stuff with you, which is like neural slide patterns with you from day one. I'm going to throw some Hail Marys.
Okay.
Because 10 years of this, I think we need some Hail Marys.
Yeah,
nobody's been able to figure it out.
Well, yeah, it's like I'm sort of desperate.